everyone, and welcome back to my channel. Today is an awesome day, right guys? Listen, uh fall is in full effect, right? And the leaves are in full fall mode, right? I love fall. It's just different, and I love different. You know me, you know I love everything different. Anything that's different is me, right? So I'm rejuvenated and enjoying this great day. It's nice, relaxing, quiet, peaceful, like just like how I love it, right? I hope everyone's having a great day as well, right? Today, though, let's get to what I'll be talking about. Today, I'll be talking about different types of caregivers, right? So over the years in my career, right, I get asked this question frequently, like more frequent than you know. So today, I'll be answering that question for everyone, as well as sharing my experience as a caregiver, of course, right? Because I am certified as a home health aide, and I started that in my early 20s, and I'm a direct support professional, so I've been doing this for a long time, right? As everybody, well, if you watch my videos, or you just know me in general, and I've been doing this for a real long time, right? So I'm a caregiver at heart. Like, if you know me, if you're around me, it don't have to be work related. I'm going to take care. That's me, right? So as you know, I like to keep my videos short as possible, but informational. So I'm gonna give you as much information as I can, with all the pertinent details, right? That's what I do, and get straight to the point. And I'm gonna try to make this video as short as I can. I'm gonna try, okay? So let's delve in. So today I'm going to start off by saying this: as a caregiver with an extensive history, anyone can be a caregiver. And I say that to say, right, this is why I say that anyone can be a caregiver, right? I say that to say that there are family members that have become caregivers of their loved ones. They even have programs where you can take care of your grandmother if you and get paid for it. So, and when I say caregiver, it's to me a caregiver is a person that really cares from the heart and knows how to take care of people and really loves taking care of others. That's a caregiver to me. That's just me personally. That's how I feel about it, right? There's people, like I said, family members with no history of caregiving, just love and compassion, and that leads me to different types of caregivers. So they have types of that they'll call informal, right? Volunteers, family, etc. Like I was saying, friends, things like that. I'm going to speak of informal and professional, right? So first and foremost, an informal caregiver is usually a friend or a family member, right, who provide companionship or some type of housekeeping, or just taking them out on errands and things like that. That's an informal caregiver that they will call it. Like I said, anyone could be a caregiver if you care, like truly care. But like I said, my definition as a caregiver is a person that really cares, and I will step in and take care of someone. And even listen, the mom is a caregiver. You know what I'm saying? So anyhow, right? I'm gonna get back to it. So a professional caregiver now, that's me. And that's a trained health professional with a variety of skills and requirements that includes home health workers and home care workers. The home health workers can help with medical needs, while home care workers assist with non-medical tasks. That's how they differentiate the two, right? So I'm gonna start with the first one. So I'm gonna go from the top down to the bottom, and which I'm saying that to say, none of the caregivers are better than others, because like I said, caring is from the heart, right? But it is a difference as far as duties, salary, and everything else, training, schooling, things like that. It's a big difference, right? So, but we all caregivers, right? So nobody get offended. All right, so RN, I'm gonna start with RN. That's a registered nurse. A registered nurse is a licensed healthcare professional who provides patient care, educates patients and the public, and coordinates care with other providers, right? And when I say professional and provides patient care, educates the patients and the public, I don't know if you remember when I was talking about medication management. A nurse teaches that. That's one of the things that they provide, like coordinates what care and providers, right? They work in a variety of settings, including hospitals, physicians' offices, nurse care facilities, and schools, right? I know you see nurses in schools. That's RNs, right? Typically, You go to school for 4 years for that, right? They also have accelerated programs that can help you become a RN in as little as 16 months, right? RNs have a lot of trainings, right? Such as medication management, like I had named before, right? They prescribe drugs and medical services, right? This is to name a few, right? The salary is typical $86K a year. That's what they make. That's the typical salary for a year. It's 86 and more, right? So as I'm talking, I noticed that I will be doing this video. I was gonna say I was gonna do the video more than one part, but I'm gonna try to get it done now because I like to keep my videos short. But I'm gonna try to get it done right. There go my ADHD going all over the place. But however, I'm gonna go back. I'm gonna go to LPN. So a LPN, that's under a nurse. A LPN stands for licensed practical nurse, right? LPN is a healthcare professional who provides basic patient care and comfort, right? LPNs work, like I said, under the supervision of a registered nurses, doctors. They do stuff like monitoring the patient's status, keeping up with the up to date with the medical records, communicate with the patients and their families. You probably see them coming to you inside of a hospital if you're, you have a client or been in the hospital, you'll see them come up to you. That's LPN. They clean wounds. They typically manage basic care, right? They usually work in hospitals, like I said, residential care homes, physicians' offices, private home. LPNs must complete state-approved educational program, which is done in a year or so, right? Their salary is about $47K. So you see that's like about half of the nurse, right? And it's getting lower. Not their salary. I mean, as I go to the next healthcare professional. CNA is the next one, right? That's under the LPN. CNA stands for Certified Nurse Assistant. CNA is a healthcare professional who provides basic care and supports to patients and nurses. Kind of do something similar to what the LPNs do, right? All right, so CNAs work under supervision of doctors and nursing duties and usually do stuff like including bathing patients, right? Now we get into the fun part, huh? Bathing patients, feeding patients, taking vital signs, stocking supplies, among many other duties. They say CNAs are known to have less difficult jobs than nurses. They say. Well, anyway, I am neither one of those. So I do not know the specifics as far as like, how their politics were with them to, those two professions, However, those professions, they would know. So CNA classes take up to 12 weeks. I've known some programs that take up to 6 months long, as well as taking a CNA exam for that state that they're in. And they have to take like a knowledge of nurse assistant duties and procedures. Their salary is $35K. So he's getting lower. $35K annually, that's starting, right? So let's go to HHA, Home Health Aide, that stands for, right? And a home health aide is a medical professional who is responsible for helping their clients with day-to-day tasks, like bathing, dressing, getting down to nitty-gritty, right? Bathing and dressing, light housekeeping, meal prepping, transportation, monitoring vital signs, right? They'll take, blood pressure and stuff like that. Not like what a CNA does or LPN, but, basic vital signs, right? Medication management, right? That's to name a few, right? And to become a home health aide, you must have a high school diploma, excellent communication, organizational skills, the norm, reliable transportation, they say, some of them. Matter of fact, yeah, you do. It's a kind of demanding job, because you're taking care of people. So must be CPR first aid certified, able to lift, right, a certain amount of pounds. I think that's one of the requirements, if I do remember. So they usually work with elderly, disabled, or chronically ill clients or patients. Home health aides usually work in homes of patients, and their salary is about $30K annually. So it's kind of similar to CNAs, kind of. So I was gonna get into PCA, but PCA is personal care aide, and it kind of falls under the same category as home health aide. if you know, you just feel it is kind of the same category, right? So, all right. Lastly, I'm going to go to DSPs, direct support professionals, right? A direct support professional is a professional that help people with intellectual or developmental disabilities. They help them to become more independent and integrated in their community, right? That's by definition, I'm gonna say, right? But a direct support worker usually works with individuals with intellectual and developmental disabilities. DSPs usually, and that's for short, of course, I said DSPs. So DSPs usually work in a home setting or a day support setting that usually cater to, like I said, IDD and DD communities, right? The duties are light housekeeping, cooking, transportation, monitoring individuals, documentation that is a must in this field. All of these fields, documentation is a must. And I know I have said that in my videos before. All of these, in a healthcare profession, if you're in a healthcare profession in any type of form or shape, documentation is number one, is vital. I ain't gonna say number one because it really is your patients, clients, or your individuals, right? But documentation comes right after that. Okay, so that's important. So that's another requirement is, organizational skills and things like that. And that's among other duties, right, for a direct support professional. In order to become one, you need a high school diploma, valid driver's license, CPR first aid certification, medication management, documentation training, like I just stated, TOVA, which is Therapeutic Options in Virginia. That's for this state. And some other minute trainings. They're not so severe. It's not too much to become a direct support. The biggest part of being a direct support is really genuinely caring. That's the biggest part of being a direct support professional, caring. Because you really care, that job will come easy to you. It won't be hard if you really truly care about your clients or your individuals. You really, 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 really will have a smooth time. Some days you'll have, but let me get back to what I was saying. So the salary can vary like the rest of these professionals, and it starts like $29K, very low, right? It can be much higher depending on your experience, right? Low. So that's why I had mentioned in one of my videos that most direct support professionals that I know, including me, work sometimes 2 to 3 jobs, right? To get nurse's salary. As a disclaimer, I'm going to say this here, right? The salaries that I have stated are for the state of Virginia. It definitely can vary from state to state, right? That's number one. Of course, it depends on the cost of living, number 2, and how many years of experience that person has, number 3. That's actually the years of the experience that you have is actually a huge difference in salary. In all these that I have named, the actual you have an experience, how many years of experience you have, and I'm talking about really, really having experience. Not saying I've been doing this for 10 years and you only been doing it for 2. No, I'm talking about actual experience is a huge difference with these salaries that I've just mentioned, right? I have worked at companies where we have the same certifications, same job title, but have got paid triple their salary due to the experience, right? So that's why it's a good practice not to tell your coworkers your salary. That's a good practice to have in general. I don't care where you work, right? Because that can cause big problems, right? At any workplace. Like I said, it doesn't matter where you work at. That can cause problems. People, I don't even like when people tell me this. I don't care how much you make. That's weird. And you shouldn't tell people that. You know what I'm saying? Not being rude, but that's very, I don't know. So, and it's very distasteful. That's the word I was looking for. Very distasteful, and it doesn't matter where you work, right? So that's why it's good not to tell people your coworkers your salary. Don't discuss your salary because you have more experience. They could be making $17 an hour. You could be making $25. They don't know that. Only you and the employer knows that. And that's all it should be said to. You know what I'm saying? And that's it. It shouldn't be spoken about with your coworkers. It's very distasteful anyway. Cause a lot of problems. So The caregivers I named just don't stop there. Like I said, anyone that cares for people in a professional or home setting, whether it is family or not, is a caretaker in my eyes, right? Truly, genuinely caring about people and taking care of taking the initiative to care for them is a caretaker to me, right? These are the ones that are, that's usually often named, especially if you have an assisted living facility, group home, these are the ones that's going to be named most. But and let me be clear with this too, as far as group homes, because that's what I'm into. I'm with the group home group. So in group homes, you're going to have direct support workers. Put it like that. I have never been in a group home where there's a nurse. Now, I've worked in group homes where you are trained to be as a direct support worker, and that's not why they hired you, but are going to school for nursing or nurse and just looking for, I've seen it like that. But in a group home setting, you're going to be hiring direct support professionals. That's who you will be hiring, right? I don't know how it is in any other state, but I know over here in the state of Virginia for group home settings, working with IDD and DD and the DD community, you will be hiring direct support professionals. So with that being said, I hope my viewers got an understanding on what the different type of caregivers, what the different type of caregivers are and what they do, right? The requirements and their salaries. But moreover, I really want people to know that caregivers are needed in life. They are vital to human beings as a whole, whether it's a special needs community or in general. Caregivers are so important, right? So if you know someone in the caregiving field, say something kind to them, some encouraging words, make their day, because that means they really care. Especially, and the most of them that I know, that I really will, even talk to, they really care. These people really care about people genuinely. It like within their heart, they really do care. So say some encouraging words if you know a caregiver, and make their day. And I hope everyone continue to have a great day. Until then, send me the emails at serenelivingnow@outlook.com, or you can visit my website at serenelifeforyou.com. Leave your info and I will go back to you as soon as possible. So see you on the next video. Bye.